Hi, I'm Dr. Ben from Mornington Peninsula Chiropractic Centre. I wanted to talk to you today briefly about ice packs and how to use them. You see, somehow, due to marketing of some of the greats like Deep Heat and Denkarub and those sort of companies, people have got in their mind that whenever they injure their spine, they should put heat on it, whether it's a hot bath, whether it's deep heat, whether it's have a hot shower, that when they injure their spine, they put heat on it. Don't! It's really important that whenever we injure a joint in our body, whether it be our ankle, our thumb, our toe, our knee, or our spine, that we apply cold. You see, when we first injure a tissue or strain or sprain it, often it bleeds. Often we get an inflammatory reaction occurring. And so one of the things we want to do is we want to reduce the amount of inflammation that occurs at the time. And the best way to do that is to use an ice pack. It's simple, it's cheap, and it's effective. And there's an example of an ice pack that we use in the practice. There's lots of different things you can use. You can use a cold towel put in the freezer. You can use a packet of frozen peas. You can use whatever you might be able to get that's really, really cold at the time. But I strongly recommend that you get some gel packs, put them in the freezer at home, have them on hand for when someone does an injury. They freeze really quickly, they hold the cold, and they're quite malleable so that you can apply them to the surface that you're wanting to put the ice on. So you injure yourself, grab yourself an ice pack, wrap it in a tea towel, so never apply it directly to the skin because it could cause a bit of a skin burn. So just wrap it in a tea towel or a t-shirt or something thin, and then you apply it to the joint. If it was, for example, an elbow that you're applying it to, just wrap it around the joint. You can tie it just on just gently so as it sits against the skin, and then you leave it on for about 20 minutes. Not much longer than 20 minutes, because if it gets too cold, the body might go into a bit of a reaction and put more blood and swelling into the area. So we don't want to get it too cold. So about 20 minutes is about the right amount of time. Then take it off, pop it back in the freezer for 40 minutes, let it get cold again, take it back out and reapply it. So it's 20 minutes on, 40 minutes off, 20 minutes on, 40 minutes off, 20 minutes on, 40 minutes off. And you do that 3 or 4 times until you've taken the heat and the swelling and the inflammation out of the tissue. And that may continue for a number of days. You know, there's often been this whole, ice for 24 hours and then heat. Well, maybe the joint will remain inflamed for longer than that. So you do it as long as that joint is inflamed. So ice pack, whenever you first injure a tissue, whether it be your thumb, your toe, your knee, or your low back, put ice on it as quickly as you can. Apply it for 20 minutes, take it off for 40, and then back on for 20, and then keep going until that swelling's down. So I hope that explains ice application. Remember, look after your spine.